Our next group of viruses are the togaviruses. And obviously, our hook is going to be about togas. So we set our scene in an Ottoman city, or maybe it's Byzantine, I don't know, some blend of Roman and Turkish where people wore togas. So as we're drawing the scene, first take note of the orange and warm colors that tells us right away that this is an RNA virus. And the sunny scene, of course, is that it's specifically a positive sense RNA virus. And remember that all RNA positive viruses replicate in the cytoplasm. So if you look in the background, you can see a big nucleus-shaped dome. And you see that our scene is taking place outside of the nucleus. There are two types of togaviruses that we want to talk about here: arbovirus and rubella. But let's start with arbovirus. So to illustrate arbovirus, we have a man riding in on a horse into the scene. And as he's riding in, he hits his head on this arbor, and his red turban falls off. The arbor will help us remember that we're talking about arbovirus, and arbovirus is actually short for arthropod-borne virus, and this most commonly is referring to mosquitoes, which is why we're adding mosquitoes swarming around his head too. So there are multiple different types of arboviruses, but we want you to be able to recall three of them. There's Western equine encephalitis, which is found in the western United States, Eastern equine encephalitis, which is found in the eastern United States, and Venezuelan equine encephalitis, which is found in Central and South America. Big surprise. We've drawn this compass on the back of the horse to remind you of these names based on geographical locations. And the horse itself is to help you remember equine in equine encephalitis. Finally, the red turban is our recurring symbol for encephalitis. Think of a red, inflamed brain, which can present with symptoms like headache, fever, altered mental status, and focal neurodeficits. So let me review that again because I went through a lot rather quickly. We've demarcated that this portion of the sketch is dealing with arbovirus by having this man hit his head on an arbor. Arbovirus really stands for arthropod-borne virus because arthropods, like mosquitoes, are the vector, and we've shown mosquitoes here. There are three types of encephalitis you need to know: Western, Eastern, and Venezuelan. They're called equine encephalitis, so we have the horse for equine, and the red turban is our symbol for encephalitis. And there's no treatment for arbovirus, so we can only really try to protect ourselves with netting, bug spray, and protective clothing coverings. So let's move on to the main attraction of togaviruses, and that's rubella, which is also referred to as German measles. Rubella will center around a young emperor, and we made the emperor a child because rubella is one of the exanthems in childhood. But before we go any further into rubella, I just want to point out that all of these togas on these people not only help us remember that this scene is about togavirus, but it also happens to be our symbol for a virus being enveloped, as opposed to naked. And that's pretty coincidental, and it makes it really easy for us to remember that togaviruses have an envelope. Rubella really has three separate presentations for three different age groups. There's congenital rubella, rubella in childhood, and then in adulthood. And all three, again, have very different clinical presentations. So we'll go through all three, but we'll start with the childhood exanthem. Our emperor is wearing a crown made of bright red rubies. Rubies is the hook for rubella. And there are rubies everywhere to help us remember this. Also, let's look at some of the detail of the crown. We've added these chains of rubies that run behind his ear and down the back of his neck, and he's grabbing at the back of his neck like he's very uncomfortable. And this is to help us remember that rubella can cause tender post-auricular and occipital lymphadenopathy. Rubella, with an alternate name like German measles, definitely has to cause a rash. And luckily, it has a distinct pattern of rash that should really help you in identifying it clinically. It's maculopapular, and importantly, you should know that it begins on the face and spreads downward. To represent this, we've added rubies falling off of his crown. So these little red bumps started up on the forehead and moved downward from gravity. So the prodrome of rubella consists of mild fever, lymphadenopathy, and fatigue, but always keep rubella in mind when you see post-auricular lymphadenopathy or this maculopapular rash moving downward. Also, when deciding between various pediatric rashes, the rash of rubella moves faster than the rash of measles, and it doesn't darken or coalesce. The rash typically is present for only around 3 days. Rubella can spread via respiratory droplets. So to remember this, we'll have some servants fanning the young king, and there are small water droplets coming off of these palm fronds. This can help you remember that the wind or breath can spread rubella with respiratory droplets. As I mentioned earlier, rubella can present in the neonate, as it is one of our torches infections. Can you remember all of the torches right off the bat? Use the acronym, and it can help you. They're Toxoplasma gondii, rubella, CMV, HIV, HSV, and syphilis. But don't forget the others like varicella zoster and parvo. So if rubella is a torches infection, that means it can cross the placenta and affect the fetus in utero. Then, later, the child can develop congenital pathology. Congenital rubella consists of a constellation of symptoms that you should definitely be familiar with. They're mental retardation, microcephaly, deafness, blindness, cataracts, jaundice, patent ductus arteriosus, pulmonic stenosis, purpuric blueberry muffin rash, and radiolucent bone lesions. And yes, that's a ton to remember about congenital rubella, and you should try your best, but we're going to go through these, so don't freak out too much. The main triad for congenital rubella is congenital cataracts, sensory neural deafness, and patent ductus arteriosus. We're going to cover all of these symptoms in the torch infection along this wall back here. So first, let's add some torches to help you remember that this is the torch infection space. So as I said, the triad consists of patent ductus arteriosus, cataracts, and deafness. Let's start with patent ductus arteriosus. We've made this wall back here look like a Roman aqueduct, and we'll name it aqueductus arteriosus. Of course, to remind you of ductus arteriosus. We've added an open sign underneath so that you remember that ductus arteriosus is patent. Also on the wall, we'll have these little baby sculptures with creepy, staring blank eyes to remind you of congenital cataracts. These little babies are also covering their ears to help you remember the sensory neural deafness caused by rubella. So that's the classic triad. We'll add some other symbols for you to remember some of the other symptoms. We've made the archways of the aqueduct shaped like blueberry muffins, and we'll even draw some little blue gems around the muffin shapes and on the babies to remind you of purpuric blueberry muffin rash. Blueberries. Finally, we'll paint the baby sculptures a nice golden yellow to remind you of jaundice, another feature of congenital rubella. And I think you're pretty good if you can remember all of that. That's definitely the more high-yield symptoms. Okay, we've talked about congenital rubella and childhood rubella, so now on to adult symptomatology. And luckily for us, it's easiest to remember. Adults, like children, will also have lymphadenopathy and fever, but they can also have arthralgia and arthritis. So see these two adult servants? We have them kneeling by the child, fanning him for hours and hours. And so, of course, they've developed some knee pain. So we've drawn some pain lines around their knees to represent that they have arthritis. Unfortunately, rubella has no treatment, but there is a vaccine that's very important to remember. It's covered by the MMR vaccine. So if you're like Jenny McCarthy, you'll know this as the cause of autism. Well, these vaccines also have another use. They prevent deadly illness. It's a live, attenuated vaccine, and it induces both humoral and cell-mediated immunity. To help remember this, we'll have a live puppet show for the children. Again, this is a live, attenuated vaccine for measles, mumps, and rubella. So there are 3 puppets to represent these 3 viruses. Also, because it's live, it should not be given to pregnant women or immunocompromised people. In fact, women getting the vaccine should hold off on getting pregnant for at least a month to reduce transmission to a fetus. So notice in the puppet show, we see one evil puppet that has a syringe with the vaccine, and then there's one pregnant puppet trying to avoid getting poked by the vaccine, because it's not administered to a woman while she's pregnant. Naturally, this puppet show has a happy ending, so we have a good guy puppet between them, defending the pregnant woman puppet with a sword, thus preventing her from getting the vaccine. So I also said you shouldn't give it to immunocompromised patients. In HIV-positive patients, the vaccine should be withheld until their CD4 count is high enough. In general, if it's over 200, then they should be able to tolerate the vaccine. So to remember this, we'll add this ticket count of 200 for the puppet show. This ticket booth actually brings us to our last point about togaviruses, and it's a general characteristic that's also shared with picornavirus. Togaviruses produce one long polyprotein precursor that is then cleaved by viral and host proteases. We're showing this by showing a long roll of tickets, so that's the polyprotein precursor, that are then being broken off as if they're being cleaved by proteases. Remember, we also use these tickets in our picorna overview video. All right, one last thing, actually. There are definitely buzzwords associated with the boards, and a big buzzword for rubella is immigrant, as being an immigrant may mean that you're unvaccinated. And the way things are going now with the anti-vaxxers, this may actually change. I guess for now, just be suspicious when a child has a descending rash with lymphadenopathy and is an immigrant. Think rubella. This was a lot of info we covered, but I think we've broken it up nicely. But maybe it'd be smart to review this once more.